Hi, this is Dr. Corey Maas on Looking Your Best. I want to talk today a little bit about facial volume and volume restoration, which is a really common thing now, and it's one of those things that, like many things in plastic surgery, I think is being way overdone, with people looking incredibly puffy. Even the movie stars and television personalities are coming out with what appear to be overblown up faces. Some of it's inappropriate or overuse, just simply too much. Some of it's about placement accuracy or where you're putting it. Now, I say that with some conditions because everyone should understand if you're getting facial volume restoration, and I'll tell you where those target areas are in just a moment, there is going to be a transitional period of time when you're going to be swollen and appear a little bit overfilled. And depending on which filler you get, or which you choose to get, because there are several options, that duration, or how long that swelling or edema or extra fluid, if you will, the extra swelling can last, will be different. With facial volume restoration, there are really different categories or different ways to divide the areas of need up. The most common volume loss that's associated with aging, which we call age-related lipodystrophy, or other even medications that can cause facial volume or fat loss, are in the temple zone here, in the area in and around the middle part of the face, the mid-face zone that we talk about, and in many cases in the submalar or cheek area. Now, you notice I've excluded the lips, and I could include them in a volume restoration area because lips do get thinner with age, but I think of lips as being a sort of special area for volume restoration and contour, and an area also that's very commonly over-treated, and we all have seen patients or people with lips that look disproportionately puffy or unusually puffy that don't look natural. And the goal should always be natural restoration of facial volume that enhances our features. There are some people that are born with naturally very flat mid-faces or loss of or absence of volume in the temporal area. And for many years we've had facial implants that are very good options, cheek implants, chin implants, even temporal implants that are long-lasting, reversible products that can be used in these areas, but they require surgery. They shouldn't be forgotten, though. For many patients, these do represent the best long-term option, and if we look at the economics of it, certainly a one treatment and done type of option can, for many people, be the very best option. So I ask everyone who's coming in for fillers if they've heard of or even considered facial implants, malar or chin or temporal implants, as an option for consideration. Certainly not forcing them or just telling them that's the only or best option, but it's certainly one that should be considered in anyone that has volume loss. So if we look at those areas that we've talked about, there's categories of fillers that are really designed to last for longer periods of time. And those used to be the stimulatory fillers, namely Radiesse and Sculptra. And those were the first two that had indications for lipoatrophy or loss of fatty tissues in the face, primarily affecting the mid-face cheek area, also the temporal area, the area above, just below the hairline on both sides, obviously. Radiesse and Sculptra are both microparticulate, tiny little particles that are injected in some type of carrier gel, and they respond by actually the body making collagen to surround each of those little particles, which eventually dissolve on their own. But it's that inflammatory stimulation that causes over time, in the case of Sculptra, the buildup of tissue. In the case of Radiesse, there's an immediate result with these little spheres, and then a replacement with collagen over time, which gives a nice duration of effect. My strong preference, if you're going in the direction of microparticulate, small particle type of volumizing fillers, is Radiesse because of the limited inflammatory reaction to it and the fact that the body really accepts it. If you look at biopsies or tissue that's surrounding these areas, there's limited inflammation versus the Sculptra product where there's quite an intense inflammatory response which for my personal preference I'm not fond of. So in the microparticulate fillers, those are small particles basically injected to create volume. There's Radiesse and the Sculptra product. Now there's some newer products in the HA or hyaluronan family that have been looked at very carefully for mid-face volume. In fact, one designed specifically for that, namely that's Juvederm Voluma. And in the studies that led to Juvederm Voluma's approval through the FDA for the mid-face, the average duration of effect after treatment and an opportunity for one touch-up treatment a month later was almost 2 years in nearly half the patients. So we're talking about very long durations when we're using Voluma, Juvederm Voluma, the HA filler for the mid-face, but it can be used in the temporal and those other zones I mentioned. And this really does provide a viable alternative to facial implants because of the duration of effect. Alongside of Voluma, the Juvederm product, Restylane Lift is a larger particle hyaluronan or long-chain sugar HA product. And the benefit of both of those, the Juvederm Voluma and the Restylane Lift product, is they are both adjustable. We can use an enzyme called hyaluronidase, which is a naturally occurring enzyme in our body and it's throughout the animal kingdom. But we can take a little bit away or a lot away or all of it away if we want to. So the adjustability of using the hyaluronans as volumizing fillers makes them particularly appealing. They are very inert. They just occupy space. There are very few reactions to these products, although I have seen some inflammatory reactions. They're quite uncommon. And like any implant material, the infection is a risk, albeit quite small. It's something that people should be aware of. In general, the acceptability and satisfaction and the outcomes for these products are very high. And in particular, it has expanded for us the opportunity to restore or even create mid-face volume that didn't exist in patients with a limited downtime office-based procedure that's very comfortable. So in general, again, just to break it down, those are coming right out of the syringe and right off the shelf. The implantable, the truly preformed implants are more surgical, so those have to be planned and ordered according to the size and shape of your face, and there are many different sizes and shapes we can talk about later. And the last one, which I think is exciting and is always something that's talked about, is the use of autologous fat. Autologous means it's your own, and we borrow fat from somewhere where you don't need it. It's carefully washed and prepared and transferred through really an injection technique, so we get it down to where the little particles and fat cells, along with what's called stromovascular layer, the sort of structural components of our fat, are able to be injected in small 18 to 19 really small needles, just like a filler would be injected. The benefit of using fat is that we're not just moving fat cells, but we're also moving periocytes and mesenchymal stem cells, or what's probably more appropriately termed mesenchymal signaling cells, as Arnold Kaplan has proposed, one of the fathers of sort of regenerative medicine and stem cell research. And the idea behind that is it's a lot more than just the filler then. We're certainly getting the volumizing effect from the adipocytes, the small fat cells, but we're also putting in cellular messengers, stimulating cytokines, the messengers that send out signals to build up tissue, and offering a long-term solution using your own tissue. The one downside to fat transfer, it's a real procedure. It's something where we have to plan it. You have to harvest it from some area. That requires very gentle liposuction and then preparation of the fat. And typically there's going to be some swelling and or bruising, a little bit more than what we'd see with just using standard fillers. But again, the benefits, those are all things that we have to talk about, discuss, and come up with a best solution for each individual, for you. I mean, that's the key to all these things. But if we talk about then volumizing fillers or implants, there's those preformed implants, cheek, chin, jawline, temple area. There are the out of the syringe fillers, namely the particulate fillers, Radiesse and Sculptra, which are the two main ones used in the US. And then probably I think the best and most adjustable, the hyaluronans, which in the categories where we're using them, I think Juvederm Voluma and Restylane Lift are the two primary products for use in truly restoring or establishing even proper volume and contour to the mid-face temporal areas and other areas where there's commonly volume loss in the face. So that's a complicated topic, and there's lots of options in there, including, as I mentioned, autologous fat, your own fat transfer. Each of them have their own sets of benefits, and each of them have their own sets of risks, but it's worth talking to your doctor about these, and those that can offer any of those really give you the best course of action that works, that suitably works for you and what your needs are. If you have any further questions about facial volume restoration or fat transfer, implants, or any of the fillers that we've talked about, don't hesitate to write to drmaas.com. You can send photographs, videos, or even just a short story, and we're happy to work privately or share that information with the general public so that everybody understands our decision tree, what we're making, just like I speak with each one of my patients about these options. It's my pleasure to discuss these things with you. This is Dr. Maas on Looking Your Best.